Welcome to today's video where we'll be exploring diabetes, what it is, how it affects the body, and why it's important to understand. I'm Nimota, I'm a hospital pharmacist in the UK, and today we'll break down this common but often misunderstood condition. In today's video, we'll cover what diabetes is and how blood glucose regulation works through insulin and glucagon. We'll examine scenarios of high and low blood glucose to illustrate normal regulatory processes. We'll then discuss common diabetes symptoms, the difference between type 1 and type 2 diabetes, and potential complications. By the end, you'll have essential knowledge for your pharmacy studies. Before we begin, let's assess what you already know about diabetes. On screen, you'll see 6 questions that test your baseline knowledge. If you're unsure of the answers, that's perfectly fine. That's what this video will cover. Try to answer them now, and by the end of this video, you should be able to answer all these questions with confidence. Now, let's move on to understanding diabetes. Diabetes affects millions of people worldwide, and its prevalence continues to increase. But what exactly is diabetes? In simple terms, diabetes is a chronic disease that occurs when there's a problem with insulin. Either the pancreas doesn't produce enough insulin, or the body can't effectively use the insulin that it produces. This leads to high blood glucose levels, which can cause serious health problems over time. To understand diabetes, we first need to understand how our bodies normally regulate blood glucose. At the center of this process is the pancreas, an organ containing special cells called islet cells. These cells act like little sensors, detecting blood sugar levels and releasing appropriate hormones in response. The pancreas produces 2 main hormones for blood glucose regulation, insulin and glucagon. Insulin is released when blood glucose levels rise, such as after a meal. It works by helping glucose enter cells where it can be used for energy. On the flip side, glucagon is released when blood glucose levels fall, such as during exercise or fasting. It works primarily on the liver to increase blood glucose levels. Let's take a look at 2 scenarios to better understand this balance. When blood sugar drops, perhaps because you haven't eaten for several hours, your pancreas detects this drop and releases glucagon. Glucagon signals your liver to release stored glucose and create new glucose, bringing blood sugar levels back to normal. It does this by stimulating the breakdown of glycogen into glucose and promoting the creation of new glucose through a process called gluconeogenesis. Conversely, when blood sugar level rises, like after eating a meal rich in carbohydrates, your pancreas releases insulin. Insulin helps to move glucose from your bloodstream into cells through the body, bringing blood sugar levels back to normal. It helps muscle cells take up and use glucose. It also helps fat cells to absorb glucose, and it signals to the liver to stop producing new glucose and instead store it as glycogen for later use. In people with diabetes, this finely tuned system breaks down. The disruption in blood glucose regulation leads to several characteristic symptoms. These include excessive thirst. High blood sugar draws water from your tissues, making you feel dehydrated. Increased frequency of urination. Your kidneys work overtime to filter and absorb excess glucose, producing more urine. Feeling tired? When glucose can't enter your cells, you lack energy. Unintentional weight loss. Without insulin, your body breaks down fat stores for energy. Recurrent thrush? Excess sugar in the urine can lead to infections. And finally, blurred vision. High blood sugar can temporarily affect your lens shape and cause microvascular damage. There are 2 main types of diabetes with different causes. Type 1 diabetes occurs when the immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. People with type 1 diabetes produce little to no insulin. The exact cause remains unknown, but it's believed to be a combination of genetic predisposition and environmental triggers. Type 2 diabetes, which is more common, develops gradually. In type 2 diabetes, cells become resistant to insulin's action, and the pancreas can't produce enough insulin to overcome this resistance. Risk factors include physical inactivity, excess weight or obesity, family history, and age. Untreated or poorly managed diabetes can lead to serious complications. Chronically high blood glucose levels damage blood vessels throughout the body, with particular impact on the following: healing. Wounds heal slowly due to poor circulation. Cardiovascular system. There's an increased risk of heart attacks and strokes. Eyes. Potential vision loss or blindness from retinal damage. Kidneys. Progressive kidney disease that may require dialysis. Nerves. Damage can cause pain, numbness, and foot ulcers that may lead to amputation if untreated. So that's everything we'll cover today in this brief overview of diabetes. In summary, diabetes is a chronic disease resulting in high blood glucose levels that can lead to various complications. Insulin decreases blood glucose by promoting glucose uptake and utilization. Glucagon increases blood glucose by promoting glucose release and production. Type 1 diabetes occurs when the pancreas can't make insulin. And type 2 diabetes occurs when the body can't effectively use insulin or not enough is produced. Understanding diabetes is the first step in managing it effectively or preventing its development. In future videos, we'll explore type 1 and type 2 diabetes in more detail, discuss insulin treatment and other medications, and examine complications like DKA. If you found this video helpful, please like and subscribe for more health education content. Thanks for watching, and I'll see you in the next video. Don't forget to use the free revision worksheet linked in the description to test your knowledge and find the answers in the video. I hope you found this video helpful. Please like and subscribe for more health education content. Don't forget to use the free revision worksheet linked in the description. Thanks so much for watching, and I'll see you in the next video.